Welcome back. Quite a number of countries are battling rapid rebounds in COVID-19 caseloads, including South Korea. On Viewpoint today, we assess the current situation and explore the options available to better address this latest wave. For more, I have Professor Howard Lee from Seoul National University. Professor Lee, welcome back.
Good afternoon.
I also have Professor Peter Chin Hong at the University of California, San Francisco, live on the line. Professor Chin Hong, it's a pleasure to speak with you again.
Same here, Sunny. Thanks for having me on.
Right. Professor Lee, South Korea's daily tally has soared to levels last seen over 3 months ago. How high do you expect caseloads to rise before they begin to retreat?
It looks like we're riding a new tide in the COVID-19 battle in South Korea. The daily new cases, number of new daily cases has just exceeded 100,000. Likewise, the number of hospitalized patients is on the rise. Based on the previous resurgent experiences, it looks like we are expect to see more cases, more significant in more significant numbers in the next month. Again, based on the past experience, I think the number can go as high as more than 400,000 a day. This expectation is based on two facts. Number one, the BA.5 has been dominating the virus population recently in Korea. And number two, the BA.5 is by far the most contagious subvariant we have ever seen.
Right, I see. And Professor Chin Hong, the US is also reliving through a resurgence. And that being said, what can you tell us about transmissions there and the tallies with regard to critical cases and the fatality rate?
Well, Sunny, the U.S. is seeing amongst the highest levels of community transmission that we've ever seen in the pandemic. Although there are only officially 100,000 or so, 130,000 cases a day in the U.S., most people are doing testing at home, and some people are not even testing anymore or getting false negatives in the beginning. At the same time, our hospitalizations are going up a little bit, about 30%, but nothing compared to where we were in January. And our deaths are still around 400 a day, but again, very different from, say, December when we were more than 2,000 a day. So some good, some bad, lots of transmission. And when you look at the wastewater epidemiology, it's definitely amongst the highest we've ever seen.
Right, I see. And Professor Lee, how do you assess South Korea's tallies with regard to severity as well as fatality? And for the sake of comparison, how do they compare with the figures we saw during our previous wave?
As the number of new daily cases has been on the rise, we are starting to see more and more severe cases. For example, daily severe cases yesterday was 177, which almost doubled the number a week before. But when it comes to case fatality, it has been under 0.1% since March, which also shows a decreasing trend. I think a couple of explanations are possible. Number one, many people have been vaccinated. Vaccines are still effective in getting symptoms milder and shorter, although it may fail in protecting you from getting infected. And so my short answer to your question is that we don't need to get panicked at this point about the resurgent.
Right, so
recently.
we don't need to be that worried.
No, I don't think so.
Yeah. Right. Professor Chin Hong, health authorities in the U.S. have recently recommended Novavax's COVID-19 vaccine for adults aged 18 and above. I understand Novavax uses a technology that is quite familiar. Could you tell us a bit more?
Yes, definitely. So it's the fourth vaccine approved in the U.S. It took some time for the U.S. Because it's been approved in so many countries around the world. It uses a more traditional technology, which is based on what's called a protein subunit vaccine. So in the mRNA vaccine, everyone knows you put the code to the spike protein on a fatty bubble, and you deliver it to the cell. The cell then makes the spike protein, and then antibodies develop. In the Novavax technology, like hepatitis and human papillomavirus vaccines, you chop up the protein beforehand, so you don't send the code. It's a more later step. The protein then gets delivered to the cells, and the antibodies are developed after the immune system sees the foreign invader. So much later process, more traditional, but a very good vaccine.
Right, and staying with that then, Professor Chinong, do you see this reality, the fact that Novavax's COVID-19 vaccine uses a familiar, a more traditional vaccine technology, do you see that as perhaps boosting vaccine uptake over there in the US?
Unfortunately, I don't think it will move the needle too much. And even if you look at the orders for the vaccine from the Biden administration, there are only about 3 million that they ordered. And there are about, anywhere from 25 to 50 million Americans who still haven't been vaccinated. So even the Biden administration is acknowledging that not everybody will jump on board. I think Novavax is probably going to be best as an extra vaccine for the world. It's already being produced generically in India, and it may have a little bit of uptake in the US from that unwilling group, but probably not moving the needle very much.
Right, I see. Professor Lee, you mentioned the BA.5 strain, and there is talk about this particular strain making patients test positive longer, despite the fact that the duration of symptoms is shorter. How do you explain this finding, and does this mean that the patient is still perhaps contagious?
I understand many share that experience. The ultra contagious BA.5 Omicron subvariant, it could make people test positive longer while the symptoms are milder and shorter. That may be because people have been vaccinated already, as I mentioned earlier. So in the case of the longer test positive, what should we do? The CDC, US CDC has not provided any specific guidance in that situation, but many experts in this field assert that once you are free of symptoms and have been isolated for five days, you don't need to extend isolation any longer.
Right. And Professor Chin-Hong, there is also talk about the incubation period of BA.5, as Professor Lee has mentioned, being shorter. Is this an accurate assessment based on what you've been hearing there in the US?
Yes. In the original ancestral strain, it was probably on average around 5 days or 6 days. In Delta, it was probably around 4 days. And what we're seeing in Omicron, and particularly in BA.5, is incubation as short as 3 days. So incubation is the time the virus starts from your body, it's in your body, to when you develop symptoms. And as Professor Lee states, it's probably due to a bunch of factors. Part is the virus probably making more in BA.5 per cell, but also part is the fact that many people are immunized already and have some antibodies circulating. So they see the enemy. They don't have to wait for a lot of enemy to be there before you get sick, because your immune system activating makes you sick. And then until that those cells build up or the virus builds up. So you're getting sicker earlier because the immune system is more primed to see the enemy.
And staying with subvariants, Professor Lee, authorities here in South Korea have confirmed at least 4 cases of the Omicron subvariant BA.2.75. What can you tell us about this particular strain?
The BA.2.75 is a very interesting species. It was first identified in India, followed by in other approximately 10 other countries, including South Korea. It is basically it is a child variant of BA.2, and also has been reported to have many more mutations, particularly at the receptor binding domain, which is a key part for the virus to enter human cells. BA.2.75 has been unofficially named the Centaurus after a Greek mythological creature, Centaur. And also, but according to the WHO has not given any official name to BA.2.75, probably because there are not much data, sequence data available yet to judge if this is a subvariant enough to be given a specific name. And that's why BA.2.75 has given another nickname, which is scariant. But according to WHO, again, the BA.2.75 is a subvariant of interest, but not of concern yet. more data will tell us if this is something that we really need to worry about. But not at this point. No, I don't think it's going to. It's not a big concern for us.
Right. So it's still evolving then.
That's true.
Professor Chin-Hong, what efforts are being made now there in the U.S. to better contain this latest rebound in COVID-19 cases?
Well, I think right now, even despite having a very comprehensive endemic plan, so to speak, a few months ago, the Biden administration is really focusing on two things right now. Vaccines, of course, but vaccination rate has really slowed in the U.S., even in the under 5 group where it was recently approved. So the other focus is on Paxlovid. So they're trying to make sure a lot of people who are eligible get Paxlovid as soon as possible, because it's going to prevent people from being hospitalized. So the ways that they're trying to achieve this, apart from publicizing it more, is by allowing pharmacists to be able to prescribe this. This was done a few weeks ago in the U.S., and it's hoped that this will allow people in more rural areas, in poorer areas, to have access faster to Paxlovid. So that's the focus right now. It's being limited because the $10 billion is being held up in the Congress now in the U.S. Hasn't been approved. We need money to continue to have all of these initiatives, particularly with the new vaccine in the fall, the new booster that we're planning.
Right. Professor Lee, here in South Korea, authorities have spoken against, that is, reinstating social restrictions, but they have shared recommendations for high-risk facilities. Mm-hmm. What would you care to add with regard to containment efforts here in the country?
The so-called, quote-unquote, voluntary social distancing policy decision made by government is primarily based, I think, based on the results of a recent survey where 60% of respondents were not in favor of the past strict measures. They don't simply want to go back to the past. Having said that, however, I think it is quite important to recover test capabilities back again in South Korea, because there are so many undetected cases hiding in the community. In order for that can be possible, and I think it's very important to lift the barriers, access barriers. In other words, it is very important to make the test, particularly PCR test, available free of charge again. And that way we can make more people to come to the clinic or some other places to get to have them tested. At the same time, I recommend wear a face mask outdoors, even though it's not a current mandate.
Right, because at the moment face masks are mandated indoors.
Indoors, right.
Right.
Yeah.
Professor Chin-Hong, there appears to be no end in sight with regard to this pandemic, but can we expect the severity of the symptoms caused by its variants perhaps to fall in the course of time?
Yes, Sunny. I think we think about two things when we think about what's going to happen. If you think about the virus itself, when you talk to virologists, they say there's no rhyme or reason why the virus will continue to get less severe. In fact, we realized from the case in Hong Kong that even something as innocent as Omicron, if it falls into the wrong soil, like an unvaccinated older population, it can still cause a lot of deaths. So rather you think about the soil, which is the population is getting more and more immune. And over time, deaths are falling. They're still too high in the US. It's double probably what normal bad flu season. And we need to address that before we accept it. But people are getting very, very tired right now. There are people who are going to get very, very sick, who are unvaccinated and unboosted if you're older, immune compromised. But there are a lot of people who have now experienced COVID themselves. They're not fearful of it anymore. They're not taking any precautions. And, that is worrisome for the future.
Right, it is. And speaking about vaccinations, that was mentioned by Professor Chin-Hong. Professor Lee, what are your thoughts on expanding the vaccination campaign here in South Korea to younger children, as is the case over in the U.S.?
Right. Currently, the vaccination rate in the younger population, younger than 19, for example, particularly younger than 10, is very, very low. So, parents are not quite into having their children vaccinated in South Korea. So I think it's very important to encourage them to bring their children to the clinic for vaccination, because vaccination helps, although it may not 100% sufficient enough for them to help, protect people from getting infected, but it will decrease the likelihood of getting severe, hospitalized, even death. So vaccination, particularly in the younger population in South Korea, is getting more and more important.
Right, it is. And Professor Chin Hong, our Professor Lee here in the studio talked about the importance of face masks. What are the prospects, perhaps, of face masks being reinstated there in the US, do you think? Especially indoors.
Well, I think it's going to be very unlikely for face masks to be reinstituted as a mandate. However, there are very, very strong recommendations. And, LA had threatened to bring it back if the hospitalizations continue to increase. So far, they are kind of stable, so it's probably not going to come back. They tried it in an area in Northern California. It didn't really work for very long. But you're going to see it still in very micro environments. So in the hospital where I work, never went away because our patients are too vulnerable. You're still seeing it in nursing homes and prisons. And in schools, it may come back at some point if there's so much virus around that education gets disrupted. So micro environments, but probably never again on a societal level, because it's not very popular in the population anymore.
Right. And Professor Lee, I was wondering here, the administration has spoken about the need to adopt a scientific approach to dealing with COVID-19, meaning that, as I mentioned earlier, social restrictions will not be implemented any longer. Speaking within your capacity as a doctor, however, what are your thoughts on reinstating perhaps such social restrictions?
I don't think that will fly. They will take off in South Korea, because people have already experienced the feeling and the pleasure of being free. So they don't simply want to go back to the past. And once they, since they have once experienced that kind of feeling, they are more likely to be resistant whatever measures the government will bring up.
Right, there is a very strong sense of fatigue.
Scientific does not necessarily mean that it has to be natural science, science based only on natural science. It also science based on human psychology, society, and everything, culture and everything. That also involves, when we call something scientific, we also entail those kind of aspects too.
Right,
yeah.
I would have to agree.
Yeah.
All right, Professor Lee, as always, thank you very much for your insights. And Professor Chin Hong over in the US, thank you very much for your time and for your thoughts.
Thank you.
Thank you.